I could see with my glasses on.
My son was 3.5 when the Lions Club screened his eyes. We discovered that my son had amblyopia.
It's typically caused by the two eyes getting abnormal and unequal input into the brain. The parents can't tell that because the child functions normally with the dominant eye.
It's so cool.
Very good.
We started with the process of his treatment in the form of him wearing a patch so that the weak eye would be forced to work.
The devices we use today are easy to use. You can do very simple training.
And you get those green circles.
To get lions out in the field doing the screenings.
Gavin, can you look right at the front of that camera? Screening the children is fairly simple. Within 30 seconds of taking an image, we can determine if the child is referred for further testing or has passed the screening.
What really made this possible is the development of technologies that allowed the detection of risk factors for problems that cause vision loss in children.
The camera checks for 13, 14 different issues with the eye. And it brings up astigmatism, amblyopia. There's a number of issues that come up.
One of the great things is the follow-up, to really make sure that the children are being seen by a professional to get those vision problems corrected.
The biggest way that this has now grown is that the pediatricians recognize that this technology
Every referral is a success story in my mind because we found somebody that needs some help.
Lions screened over 500 kids today. How many people can say that? How rewarding that is to know that you've served your community in that manner. You don't get paybacks like that very often.
Avery's on the brink of turning 16. He's a very bright young man, and he is a very good athlete, and we attribute all these things that he's able to do now because his vision has been saved through the Lions. We all have a story as to why we joined the Lions Club, and for me, my story is personal. The Lions Club saved my son's vision.
Good evening, fellow Lions. Good evening, invited guests.
Good evening.
Our discussion will now begin. I want to thank everyone for being here so early, so prompt, I should say. At this point in time, we will now open up in prayer where we'll have Lion Norman doing the Lion's prayer for us. Lion Norman.
Okay, Lions. The Lion's prayer. Where lions meet, be present, Lord. Weld our hearts in one accord. To do thy will, Lord, make us strong. To aid the weak and right the wrong. Thank you.
Thank you, Lion Norman.
Sharon, you're mute.
Not hearing you, Lion.
All right, sorry. Lion District Governor Maureen Graham, Progressive Melvin Jones Fellow, other distinguished Lions in the virtual audience, invited guests, Leos, my fellow Lions, a pleasant good evening. It is my esteemed pleasure to welcome each one of you to this discussion on blindness. Some of you may be aware that this month has been designated as Blindness Awareness Month. And it is in this light that the Vision Commission, comprising of Lion Norman Boswell, Assistant Coordinator with responsibility for Region 1 and 4, and myself as Coordinator with responsibility for Regions 2 and 3, decided to have this discussion in keeping with the vision plan for this Lionistic year, where the vision team challenged all clubs to learn, discover, and act towards the journey as it pertains to healthy vision and blindness prevention. And so I am pleased that we are having this discussion on blindness, its causes, and prevention. Tonight, we have with us 3 female doctors who will be our presenters and a surprise guest. Let me at this point welcome our presenters and our guests who, when approached, they all willingly accepted to have this discussion. Again, welcome one and all. Thank you.
Thank you.
At this point in time, we will have a short video. We will now have a short video presentation on how Lions started the journey on working with the blind and visually impaired. And that happens through Helen Keller. So we'll have that video now.
The roaring 20s in the U.S. Everything was moving. Automobiles, pictures, and headlines. The stock market was booming. But for people who were blind, it was a time of struggle. Many viewed people who were blind as incapable of being educated, supporting themselves, or living independently. So they were kept home, closed off from the world. There were some residential schools and a few public school programs in the U.S. for blind children. Lions recognized the need to help and began their journey to become Knights of the Blind. Lions' mission to serve the blind began shortly after their founding in 1917. They created jobs making brooms and checked students' eyesight in school. In 1922, Lions in Cincinnati, Ohio, asked local schools what children who were blind needed most.
Imagine you had gone through your youth with nothing but school books to read.
For more than 40 years, Lions partnered with Clovernook Home for the Blind to produce the International Lions Juvenile Braille Monthly. It was filled with stories, games, and puzzles. Lions reported that it was the first Braille magazine for children.
All of us appreciate the magazine you send each month. It would be nice if we could talk to the Lions Club and tell them how much we like the magazine.
Lions encouraged clubs around the U.S. and Canada to provide it for free. Visually impaired students from Clovernook typed, printed, and bound the pages.
We are sure that no club has ever done anything more worthwhile.
In 1925, 7,500 Lions gathered at Cedar Point in Sandusky, Ohio for their annual convention. Helen Keller, accompanied by her teacher, Ann Sullivan, spoke to Lions.
I appeal to you, Lions. You who have your sight, your hearing. You who are strong and brave and kind. Will you not constitute yourselves Knights of the Blind in my crusade against darkness?
This became a rallying cry and energized Lions to do more on behalf of people who are blind and visually impaired. Delegates unanimously voted to make Helen and Ann honorary Lions, the first women to receive this honor.
And so Lions, during that time, accepted Helen Keller's challenge, and our work ever since has included side programs aimed at preventable blindness. Keller's challenge and her dream live on. So we will now move into our presenters. And tonight, we will introduce our first presenter to you. But before our presenters go on, I would like to ask that we hold all questions until the end of all the presenters. Thank you. Dr. Lewis has a degree in optometry and one in business management. She has a wealth of experience in eye care business and has been an optometrist for 20 years. She holds a postgraduate diploma in therapeutics, which is independent prescribing. She has worked in the UK and around the Caribbean in general practice, private clinics, and in laser eye surgery, in addition to managing a diabetic eye disease service in the UK. She is a registered optometrist with the General Optical Council in the UK and with the Allied Health Council in St. Lucia, currently working with the Ministry of Health in St. Lucia within the Diabetic Retinal Screening Service. Louise was born and educated in the UK, but relocated to St. Lucia, the home of her parents, in 2015. She opened her eyes care practice, which is Belzier, which means beautiful eyes, in Castries, St. Lucia in 2020. I now present to you Dr. Louise Purcell.
Good night, everybody. Thank you so much for the opportunity, Lions, for allowing us to speak to you today. So in honor of Blindness Awareness Month, myself and two of my colleagues are going to do a presentation on blindness awareness. So what is blindness, how we can prevent it, and the things that can cause blindness, what we should be looking out for. So I'll just put my presentation on. Okay, so I hope you can all see my screen there. Okay, so to begin with, I'd just like to give you some definitions about what blindness is, because we hear the term blindness, we hear the term visual impairment, we hear partial sight, we hear all of these things, but what do they really mean? So to begin with, visual impairment is a decrease in the ability to see to a certain degree that causes problems that are not fixable by usual means, such as glasses. So when somebody is visually impaired, we're not talking about people that need glasses or need contact lenses and then can see. Okay, what we're talking about is people that even with glasses or contact lenses are still unable to see to a certain degree. So for example, they're not able to drive or to see well enough to be able to perform certain tasks. When we say blindness, we mean that they are unable to see, be it due to injury, disease, or genetic condition, but that means with no sight at all. So you can be visually impaired, which means that you have maybe a problem with your eyes, but you can still see something. But if we say blind, we generally mean that you're unable to see. So there are lots of different terminologies, as I said, partially sighted, low vision, legally blind. I'm sure we've all heard of these terminologies. And actually, the definitions do vary throughout the world. But since we are in the Caribbean and generally we go by United States standards, I'll give you the definitions according to the United States. So the first one is partially sighted. What does this mean? Well, partially sighted means that somebody has partial vision in one or in both eyes. So if we can give an example here, maybe somebody who's lost sight in just one eye, or somebody with tunnel vision. So for example, if you have tunnel vision, you cannot see to the left or to the right, you can only see straight ahead. So if you look at my little picture here, that you can see to the side here, that's somebody that can see straight ahead very clearly, but they are unable to see in the periphery, in the sides of their eyes. And we would call that person partially sighted. So they have got some sight, but not the total sight. Low vision. Well, this means severe visual impairment in which visual acuity, which means the standard that they are able to see to, is 20/70 or poorer in the better seeing eye. What does this mean? So I'm sure we're familiar when we've been for eye exams before. We've seen this chart before. So this is the chart that we normally read when we go to see our optometrist, our eye specialist. Now, 2070, as you can see here, is this third row down the chart. Now, for reference, the green line here is driving standard approximately. So what you need to be able to see to be able to operate a car. Down here, the red line is what we call 20/20 vision, what we normally term as, you know, good vision, average vision, normally what people can see, okay? So if somebody has low vision, it means they can only see to the third line down with their better eye, even with glasses or contact lenses. So we cannot improve their vision beyond that level. We've also heard the term legally blind, and I've heard this used in lots of different ways before. People say, oh, I'm legally blind, and no. Legally blind means a person that can only see to 20/200 in their better eye, that cannot improve with glasses or contacts. And again, if we look at the chart, that's literally the top letter of the test chart, okay? So looking at the chart, we normally look at the chart at a distance of 6 meters or 20 feet. In the room, when you go to see your eye specialist, the room is often much shorter than that, but the letters are adjusted for the equivalent of 20 feet or 6 meters. So somebody who is legally blind can only see the very top big letter, and they cannot see any more than that, even with glasses or contact lenses. And of course, total blindness means totally blind and not having any sight in either eye at all. Okay, this is just an example of 2 children there who are totally blind. So how does somebody become visually impaired or blind? So one of the first reasons that we'll touch on today is congenital. So this would mean that you are born with either blindness or with a condition where there's a problem with the eye or with the visual system. Now, remember, the eye is the where all the information comes in, but actually the brain, the visual cortex, is what actually does the seeing. So it's actually a whole system. It's not just the eye that does your seeing. The eye is connected to the brain by what we call the optic nerve, and the information is processed within the brain. So it's the whole visual system that has to be good for your vision to be good. So there's things like anophthalmos, where a baby can be born without eyes, or you can have other eye malformations. It's the same way you can be born without a limb or with other conditions. The same with the eye too. For example, where the optic nerve is damaged, the nerve that connects the eye to the brain, what we call optic atrophy. And this can happen due to be blind before was through rubella, which is German measles, when the mother would contract an infection such as rubella, and it could cause the fetus to be born blind. And this is less common now because we have vaccinations. There's also a condition called retinopathy of prematurity. Now, with medical technology, we're able to deliver babies a lot and look after babies, and babies tend to survive much younger than before. Before, when we had a premature baby, often it would die, unfortunately, because it was out of the womb too early. But now we're able to see babies sometimes 5 months or 6 months or 7 months, and we're able to put them in the incubator and we're able to save their lives. However, the retina of the eye, which is the back surface of the eye, actually fully develops in the later stages of pregnancy, really between months 7 and 9 of pregnancy. So if a baby is born very early, the retina often is not fully developed, and this causes other issues. It can cause bleeding, it can cause other issues in the eye, and that can also cause blindness. So there are things that you can be born with that can cause blindness. Retinitis pigmentosa is another genetic reason. It's actually a group of rare genetic disorders, and it involves a breakdown or loss of cells in the retina, which is the back layer of the eye. The common symptoms of retinitis pigmentosa is that they often start to not see so well at night, and the peripheral vision starts to get worse as well. So again, that's like the tunnel vision. So looking at the picture here, if we are to look in the normal view, we can have a nice wide field of view. But when you have retinitis pigmentosa, the view becomes constricted like a tunnel. So your peripheral vision becomes lost. And that can happen with time. So even though it's a genetic condition, it tends to get worse with time. Okay. So what other reason can cause blindness? Now, there is a terminology that you may see as well called reversible blindness. What does that mean? How can you reverse blindness? Well, we actually class what we call uncorrected refractive error as reversible blindness. And what does this mean? Well, it means that people that need glasses or contact lenses, but maybe have no access to these kind of corrections. Now, we're talking about people maybe that in the underdeveloped world, in very rural or isolated parts of the world. So these are people that maybe have quite high prescriptions that really would need glasses or contact lenses or some sort of visual aid. Because they have no access to it, actually they would be classed as visually impaired or blind. So technically they are not, because if they were able to access the optic aids, they would be able to see. But unfortunately, because of the area they live or the part of the world they're in, they may not be able to be treated. So these are people that maybe are just long-sighted or short-sighted, or have astigmatism, which is just oval-shaped eyes that can cause problems with focusing. But those of us in developed nations, obviously we don't have these issues because we can visit an eye specialist very easily, and that should be done at least every 2 years to check for glasses, for contact lenses, for eye diseases and things like that. So when you see reversible blindness, that's what that means. And that's a child having an eye exam. Okay, a bit of a gruesome picture there, so sorry about that. It's probably less gruesome than a lot of the pictures that I have, but this is through injury. So I'm just demonstrating here that you can also become visually impaired or blind through injury. And this can be like accidents, sports injuries, workplace incidents. In this instance, the patient here had a screw in their eye. So this can happen with carpentry, you know, those sorts of things where we're not really wearing eye protection. And that's why we do try to enforce as optometrists and eye care professionals that it is certain to protect your eyes, okay? So even if you're just in the garden, actually gardening brings on the worst sometimes injuries to the eye. People often can lose their sight through gardening injuries, just through a branch or a stick in the eye, which then can cause a fungal infection in the eye and all those sorts of things. So it's very important to wear eye protection. Also in playing sports, particularly squash balls. If you play squash, those balls are very small. They can actually damage the orbit of the eye. So eye protection is very important. So how else can we become blind? Well, another reason is through infection. So people that wear contact lenses, when you're not hygienic with your contact lenses, you know, you're told to make sure your hands are always very clean, make sure you don't touch your eyes with dirty hands, make sure you don't allow water to touch your contact lenses and things like that. But if you're not hygienic with contact lenses, that can also introduce infection in the eye, and that can cause blindness too. In sub-Saharan Africa, not so common in our region here, the disease called trachoma, which is actually caused by chlamydia, which is the same as the STD. But trachoma can cause scarring in the upper and lower lids, and that actually causes scarring to the front of the eye, and it actually does cause blindness. Now, actually, it is the leading cause of preventable infectious blindness worldwide, and all this would really require is treatment with antibiotics. But because these things are not available in those countries, often children can go blind through this. Now, the other reasons for blindness, the eye disease, that's what we want to concentrate on today. So I've told you about infections, I've told you about being born with an eye condition, I've told you about injuries. So these are things that you can do to prevent yourself going blind. But there are eye diseases that we commonly know that do cause blindness. And the four most common ones, and the ones that cause the most problems throughout the world, are cataract, age-related macular degeneration, also called ARMD, glaucoma, and diabetic retinopathy. Now, firstly, cataract. This is a picture of somebody with a cataract. Now, as I tell people every day, I think cataracts are not the growth on the surface of the eye. That is a pterygium, that's a growing flesh. That's something different. Cataracts are actually inside our eye. So you can see here, because this patient has nice big dilated pupils, and you can see if you look through the pupil, which is the black part, the little hole in the colored part of the eye, you can see that grayish kind of lesion here in the right eye, and that is a cataract. And what it is that it's normally due to time, due to age. And as we get older, the lens of our eye, instead of being clear, like a window to allow light in, starts to become hazy and gray. So kind of a similar process to when our hair goes grey, the lens of the eye goes grey as well. Okay, and that's all a cataract is. It can also happen due to trauma. So if you get a knock or a blow to the eye, it often brings cataracts on earlier, and due to some systemic conditions too, such as diabetes. Now, cataract is actually the world's leading cause of blindness. Now, as I'm sure we all know already, cataract actually is reversible, okay? So we can have surgery to restore our sight. So the reason that it's the world's leading cause of blindness is because when cataracts happen, which is normally when you get to about the age of 65 or 70, most people will have some degree of cataract. So if you imagine all the older people in the world, if you're in an underdeveloped nation or a rural or an isolated part of the world and you are unable to have cataract surgery, there'll be a time in your life where unfortunately you will just be blind. And that's normally would be due to some sort of cataract. And because they're unable to have treatment, it then is called the world's leading cause of blindness. But it is reversible. You can have cataract surgery to reverse this. What they would do is remove the old lens and place a new lens in to restore the sight again. So cataract is important for us here in our region. However, because we can get treatment, because we have access to cataract surgery in the Caribbean, it's not really our leading cause of blindness here. The other one is age-related macular degeneration, ARMD. Now, this is where the central vision, which is what we call the macular area, begins to wear out. So it's wear and tear of the back surface of the eye, and it's due to advancing age, and it causes poor central vision. Now, this is a leading cause of blindness in the US, in the United States, and the United Kingdom. But fortunately for us, actually, it's not as common in the Caribbean. It tends to be more amongst white people. We tend not to be so much of it with Black people, and that's for a number of different reasons. But luckily for us, it's not something that really affects us too much here, the age-related macular degeneration. But you will see it on statistics as a major cause of blindness worldwide. So what does affect us in this region? Well, I'm sure we know already the most common causes of blindness in this region are glaucoma and diabetic retinopathy. Now, with glaucoma, it's a major reason for blindness in the Caribbean. We normally advise everybody to test their eyes regularly so we can diagnose it and treat it early to prevent blindness. Once your vision is lost through glaucoma, it cannot be restored. So my colleague Kira Devine is going to give us a little bit more of an insight on glaucoma in a few moments. I think that's an important topic. And also diabetic retinopathy. Again, we have a very high percentage of diabetes in the Caribbean, and all diabetics are at risk of blindness. Now, it can be prevented with regular screening, and my colleague Jamila Fabian is going to discuss a little bit more about that with us later on. So that's an introduction to blindness, how we can become blind, what conditions can blind us, and a little bit about the diseases that we need to be on the lookout for when we go to see our eye specialist. So I'm going to hand over back to Lion Sharon to give you an introduction to my colleagues now. So thank you very much for listening.
Thank you very much, Dr. Purcell. I am sure our audience will agree with me in saying that you have enlightened us on the definition of sight, what blindness means, and how someone would become visually impaired or blind. Wow, very useful information. Again, thank you very much. I now call on Lion Norman Boswell, who is my assistant coordinator, to introduce our next speaker. Lion Norman.
Good evening.
Good
Fellow
evening.
Lions, ladies and gentlemen. Our second presenter is Dr. Jamila Fabian.
Sorry to cut you. My apologies, but Dr. Fabian is having some technical difficulties, so she's asked to trade places with me. So if you could introduce me and I'll do my talk, and Dr. Fabian will follow.
That is Dr. Sarah Devine?
Sarah Devine.
Okay.
Yes, that's correct.
Okay. So our second presenter is Dr. Sarah Devine. Dr. Devine obtained her degree in optometry in 2007 in from the Cardiff University. He's originally from Ireland and has practiced optometry all over the UK, multiple independent and domiciliary companies. Dr. Sierra has helped lead numerous volunteer projects in Africa with the charity Vision Aid overseas, both delivering eye care service to rural areas and delivering optometric training to students and ophthalmologists. He has a certificate in diabetic retinopathy, screening and vision in the age with Melbourne and London City Universities. Dr. Sierra recently completed a postgraduate certificate in ocular therapeutics with Glasgow Caledonian University. Dr. Sierra relocated from Australia to St. Lucia in 2015, where she worked alongside Dr. Louise, at various optical practice. In 2018, she moved to Barbados, where she has been working at Insight Optical. Fellow Lions, ladies and gentlemen, I present to you Dr. Sierra Devine.
Hi, good evening, everyone. Thank you very much for the introduction, and thank you for having me this evening. I'm just going to share the screen now, and we'll get started on my talk. Okay. So here we go. And as Dr. Louise was discussing before, I'm going to talk about glaucoma, which is a very relevant eye disease in the Caribbean, unfortunately. So my name is Kira Devine, and I am the optometrist at Insight Optical in Bridgetown in Barbados. And as I said, I'm going to discuss glaucoma. So what is glaucoma? Glaucoma is a disease which damages the optic nerve. The optic nerve is located at the back of the eyeball and transmits signals received from the eye back to the brain. So if you can see on the screen here, that is the optic nerve. So it's very, very important. When the cells at the optic nerve die, the signal transmitted to the brain is reduced, or in very severe cases, there will be no signal at all. And this results in vision loss. Now, I want to warn you, there are many different types of glaucoma, many subcategories, but that is a little bit too in-depth for this conversation tonight. So I am going to discuss the most common type of glaucoma, which is primary open angle glaucoma. So what causes glaucoma? Well, like many things in science and medicine, research is ongoing. So we're not 100% sure exactly what causes the damage, but the most commonly accepted theory is that it is caused by high pressure in the eye. And this high pressure damages the cells, and that leads to vision loss. So the aqueous humor is a fluid inside of the eye. The pressure which the aqueous exerts inside the eye is called intraocular pressure. And this measurement, the measurement of the intraocular pressure, is very important to optometrists and ophthalmologists. So this aqueous fluid is constantly being produced and drained out. However, if too much fluid is produced or not enough is drained out, there can be a buildup of the fluid, which causes the high intraocular pressure. So, as I was saying, raised intraocular pressure is the most common risk factor of glaucoma. However, it should be noted that it is sometimes possible to have high pressure but not have it is a slowly progressive disease. So it doesn't, as I say, in this glaucoma that I'm talking about, which is primary open angle glaucoma, it doesn't just happen overnight. It is slowly progressive. Can you hear me okay? Okay, so as I was saying, the damage with glaucoma occurs firstly in the periphery. So if you can see here in the photographs, there's the two boys with the footballs and you can see the full screen. But as the periphery starts to damage, you can see that it's black on the outside, and that's what we call the peripheral vision. And unfortunately, if glaucoma progresses, then you would just be left with only the central vision, and even at end stage glaucoma, it could be totally black. This is why it's often called the silent thief of sight. Because glaucoma affects the peripheral vision first, people suffering from glaucoma will not be aware that they have the disease until it has reached a very advanced stage. It's very, very rare that a patient would come in and say, my peripheral vision is affected. Although, however, last year I did have one patient and he was actually a cricket coach. So he was able to tell me that his peripheral vision was affected. Luckily, I got him shipped off to the ophthalmologist and started on treatment. So hopefully the rest of his vision will be preserved. But it is very unusual that anyone would ever recognize that they have some loss of peripheral vision. And sadly, when it has reached this stage, they will have suffered considerable irreversible nerve damage and vision loss. And that's the thing with glaucoma. Once the damage has occurred, the vision cannot be brought back. It's irreversible. As Dr. Louise was talking about with cataracts, if you have the cataract removed, the vision comes back. That's great. But unfortunately, that is not the case with glaucoma, which is why we really want to raise awareness about glaucoma and how to prevent it. So can glaucoma be treated? Unfortunately, as I said, there is no cure for glaucoma. But it's not all bad news. There are treatment options available which may stop the progression of glaucoma. You can have a little bit of vision loss, or it can be in the very early stages. And if treatment is initiated often, the prognosis is good. As I said, vision loss through glaucomatous nerve damage, it cannot be recovered. That really is what the message we want to drive home. Prevention is better than cure. So this means that the earlier glaucoma is diagnosed, the better outlook for the patient. And if we are suspicious that a patient may have or develop glaucoma, we like to initiate treatment to stop progression. So which glaucoma treatment options are there and what do they target? Well, the glaucoma treatment options are aimed, my apologies. Glaucoma treatment options are aimed at lowering the intraocular pressure. This is to reduce the amount of fluid inside the eye. Is someone talking? Okay, all right, it was my feedback. Right, so what I was saying was we want to reduce the amount of fluid inside the eye because high pressure in the eye is a risk factor for glaucoma. Well, this is the only modifiable risk factor. By that, I mean, it is the only thing that we can change. We can't change your age, we can't change your genetic makeup, but we can lower the pressure inside the eye. How do we do this? Well, this is done either using prescribed eye drops from the ophthalmologist or the optometrist, or there are many different surgical techniques, often involving lasers. Now, here in the Caribbean, a lot of patients are on eye drops. So if the patient is using eye drops, they must use the eye drops every day. Similar to how a patient with high blood pressure must take their medication every day, it really is imperative that a glaucoma patient instills their eye drops every day. Unfortunately, I'm sure that other doctors have come across these situations, come across patients who got a bottle of eye drops and they thought that they just used the one bottle and their glaucoma was cured. But that is not the case. It's not like an infection where you take your course of antibiotics and you're cured. No. If you are on glaucoma drops, then you have to be on it for the rest of your life or until your eye specialist says otherwise. And that is something that we really would like to educate our patients on. And it also is very important that glaucoma patients attend for regular checkups with their eye specialist. Why? Because things can change. Medication can stop working. Different things can happen. So it really is important that they follow at the dictated intervals, be it 3 months, 6 months, annually. So it really is important to continue with the follow-ups. So how is glaucoma diagnosed? As I mentioned before, the pressure, IOP, of the eye must be measured. This cannot be felt by the patient. Some people say that, oh, they feel as if they have pressure in their eye. They wonder, is it glaucoma? No, not in the case of primary open angle glaucoma. There is another type of glaucoma, which is called closed angle glaucoma. That's a very acute emergency, but let me tell you, you will know if you have closed angle glaucoma. Your eye gets very red, very, very painful. You'll become very nauseous. You can even vomit from the pain. People say it's the worst pain they've ever felt in their life. So if you have a little bit of a red eye and a little bit of eye pain, don't be concerned. It will be extreme. You will know it is happening. So apart from that, we can't feel if we have high pressure in our eye. The only way to know is by using a tonometer. So the pressure, as I say, is measured by a machine called the tonometer. There are many different types. One of the most popular blows air in the eye. So people who have had an eye test before, they might remember it, and many people call it the puff test. And as I mentioned before, you cannot feel if you've high pressure in the eye. It has to be diagnosed by your eye specialist using this machine. Other ways which we diagnose glaucoma is we observe the appearance of the optic nerve head. It is very important we look for structural changes. Changes being the important word here because everyone looks different, but what we're looking for is changes for something that was previously smaller and the optic nerve has increased in size, and that suggests to us that the cells at the optic nerve head are dying. How do we do this? Well, we look inside your eye. Anyone who has had an eye exam, they'll remember when the eye specialist looked inside their eye with the light. That's what we're looking for, many things, but that is it. We're really inspecting the optic nerve head and we size it up. We have a standard ratio for what we call the cup to disc ratio, and we mark that down on the record card. So the next time you come back, we can compare it. Another way which we can examine the optic nerve head is by a photograph, which takes a photograph of the back of the eye, and that is great also because we can store that and compare it the next time the person comes back for an eye test. Or another machine is called an OCT machine, optical coherence tomography, and that gives a scan of the nerve at the back of the eye. That is very good because when we look at the eye, we just see it front on, but the scan is a cross section, as you can see here. This is an example of what an OCT image looks like. And that, again, is a very useful tool to aid in diagnosis of glaucoma. And here I have two photographs of optic nerves. This one here, the optic nerve with glaucoma, we would define that as a very, very large cup. This little section here is what we call a rim, and we would want it to be much bigger than this. If you compare it with the healthy optic nerve head, the rim extends all the way down to here. If you can see my arrow moving, a small little, this is a cup. And if you compare that there, this is the entire cup of the optic nerve head, which has been damaged by glaucoma. So this eye here, unfortunately, really looks like end-stage glaucoma, and doubt they would have much vision left. Another way which we assess for glaucoma is using a visual fields machine. The previous methods of investigation I mentioned were observation of the structure. However, a visual fields machine assesses the function of the optic nerve. A visual fields test assesses the peripheral vision. This is the machine in the corner. I'm not sure if anyone here has ever had one. Some people like it, some people don't. What we do is we ask the patient to sit and they put their chin on this little rest here and they look inside this bowl. So we ask the patient to look into the machine, and the machine presents a series of small lights of varying brightness, which is scattered across the back of the bowl. It starts off bright and slowly gets dim, and they have to press a button every time they see the light. When it gets too dim that they can't see it, then they won't see it, so they won't press a button. What this gives to us is a printout, a plot of where they can see and where they cannot see, and the threshold of their vision. It really is a very, very useful machine. It has been around for a long time, and obviously medicine is always improving, but this machine has not, there's been no changes in it because it really is invaluable. It tests for many other things as well. You can diagnose tumors, a stroke, different things using a visual field machine. But for glaucoma, it really is important, not only in diagnosing, but also monitoring the progression. So if we have a patient who has glaucoma and we're putting them on drops, we check their visual field, we will check that regularly and compare to see if the treatment is working. The pressure might remain the same and we think this is a good level, but if we see visual field loss, progression, then we know we have to adjust the treatment and aim to lower the pressure inside the eye. So another useful measurement to assess for glaucoma is the thickness of the cornea, because someone who has a very thin cornea is at a higher risk of having glaucoma. It's not essential, but you know, it's always good to have lots of measurements. Who is most at risk of developing glaucoma? Well, as Louise said beforehand, unfortunately, it's very prevalent in the Caribbean. But like I say, anyone can develop glaucoma. Anyone of any age can develop glaucoma, but there are factors which can increase the chances of people developing glaucoma. So as I mentioned before, people with high intraocular pressure inside the eye. People with a parent or sibling who has glaucoma, that really increases the chances, in fact, from 4 to 10 times of an increased risk. Higher, in fact, if a sibling has glaucoma. So if you know your parents or your siblings have glaucoma, make sure and attend your eye specialist every year. Or if you have any friends and you know that their family members have it, please educate them. It is said that people over 40, there's an increased risk of developing glaucoma, and that definitely is true, but please, there's a caveat in that. It does not mean that you can't get glaucoma until you're over 40, because unfortunately I've seen many people in their 20s with glaucoma. So remember that this is an increased risk because anyone can develop glaucoma. As myself and Dr. Louise already mentioned, people of Afro-Caribbean descent. Another risk factor is people who have moderate to high myopia, that is short-sightedness. And as I previously mentioned, people with thin corneas. You'll only know you have a thin cornea if you have it measured. Or annually if you're in the high risk category. Remember, I spoke about the people in the high risk category before. So that is my recommendation. I like to see my patients back every year. So the optometrist or the ophthalmologist will examine your eyes and record your pressure. The results will be compared at every eye exam to check for changes which suggest glaucoma. Now, this is very important that we record your pressure. Why? Because even if you have low pressure, normal pressure ranges from 9 to 21. So imagine you come in and your pressure is 9. You think, great, I have low pressure, no problem. Brilliant. We'll record that on your record card. Next year you come back and your pressure is 18. Well, your pressure is still within the normal range, but it has doubled. This is a warning sign to us. So that is why it's very good to attend the same eye specialist. So there is a comparison, because if you went to the next eye specialist and they recorded your pressure as 18, oh, well, okay, that's in the normal range. But your pressure was previously 9. That could suggest that something is going on. So it is important to attend for regular checkups with a trusted eye specialist. Glaucoma, unfortunately, is quite tricky to diagnose. That is why we have so many different tests to try and diagnose it. But generally, it progresses slowly. So it does give us some time to come to the conclusion of the diagnosis of glaucoma. So don't be surprised if your eye specialist might ask you to return more frequently for observation before finalizing a diagnosis of glaucoma. That could be 6 months, a year, sometimes even 3 months, just to compare. As I said, comparison is really good if we can compare the pressure, if we can compare the size and appearance of your optic nerve head. We have a photograph, a scan. So we want to thoroughly examine before finalizing the diagnosis of glaucoma. So what is the take-home message? Glaucoma is often caused by high pressure inside the eye, damaging the optic nerve. So glaucoma is optic nerve damage. This pressure can be reduced using prescribed medication or surgery. Prescribed medication only. Unfortunately, I've come across some patients who would try alternative remedies, but they don't work. Well, none that I have come across. So I really would recommend going to your eye specialist for the medication for glaucoma. And that being said, only an eye care professional can detect glaucoma. That is really important. Unfortunately, I come across a lot of people, and when they ask me my job, they say, well, I don't need to come and see you. My vision is 20/20. But as I'm sure you know, or you're learning tonight, that an eye exam is not just about checking the vision if it's 20/20. We check the health of the eye. So it really is important that you come for an eye exam, even if you can see well, because you can't tell if you have high pressure in your eye amongst all the other eye diseases that there are. Only an eye professional can look inside your eyes and determine the health of your eye. So 20/20 vision is great if you have it, but it doesn't mean that your eyes are healthy. Vision loss from glaucoma may be preventable if it is detected early. So please ensure you have eye exams every 1 or 2 years as advised by your eye specialist. And I ask you, please share this information with your friends and relatives so that they can avoid blindness from glaucoma. Thank you so much for listening, and thank you, Lions, for having me, and thank you for the opportunity to come and talk this evening. And if you want to follow my practice on social media, you can see on the screen there, the Instagram, Facebook, or the website. So as I say, I practice in Bridgetown in Barbados, and the name of the practice is Insight Optical. Thank you very much. Enjoy the rest of the chat.
Okay, there you have it. From Dr. Divine. I know we are much more knowledgeable about glaucoma after a presentation. Glaucoma is one of the major reasons for blindness in the Caribbean, as you just heard, and it is called the silent thief of sight. It is irreversible, but there are treatments to shorten its progression. So the takeaway from it that you have to catch it in time. And for vision loss from glaucoma, it can be easily prevented if you catch it in time. And another takeaway is have your eye examination at least once every year or 2 years. That's the takeaway. So fellow Lions, we now move to our third presenter, who is Dr. Jamila Fabian. If I get that right. Dr. Jamila. Jamila. Thank you.
Jamila Fabian.
Jamila Fabian.
Yes.
Good.
Yes.
Graduated with her bachelor's degree in optometry from Cuba in 2009. She had worked with several eye care clinics in Antigua, including Mount St. John Medical Center. She has also worked with patients in Montserrat and Barbuda. She had worked along with ophthalmologists in eye care clinic in Antigua. Dr. Jamila, over the years, has done several continuing education classes at the International Vision Expo in New York and Las Vegas. After almost 9 years in the field of optometry, in 2018, Dr. Jamela opened her own eye care clinic, Paradise Vision Center, where she has screened patients for glaucoma, diabetic retinopathy, and other eye disease. Fellow Lions, ladies and gentlemen, I present to you Dr. Jamela Fabian.
Good night, everyone. Okay, so as Lion Norman said, my name is Jamela Fabian. I'm an optometrist at Paradise Vision Center. We're located in Antigua. So my topic tonight is about diabetes and how it can affect the eye. As we know, diabetes is very prevalent in the Caribbean as well. And I'm sure most of us have a relative or know someone who has diabetes. So first, let's talk about what is diabetes. Diabetes is an eye disease. Diabetes is a disease in which the body's ability to produce or respond to hormone insulin is impaired. This results in the abnormal metabolism of carbohydrates and elevated levels of glucose in the blood. Diabetes is classified into two types, type 1 and type 2. So what causes type 1 and type 2 diabetes? In type 1 diabetes, this occurs when your immune system attacks and destroys the insulin-producing beta cells of the pancreas. In type 2 diabetes is the most common form of diabetes and is caused by several factors such as lifestyle factors and genetics. There's also gestational diabetes, where this happens in pregnancy and is caused by hormonal changes, which can also be genetic and lifestyle changes. This is why it's very important for a pregnant woman to ensure that she's checking her sugar levels, she's doing her visits, her scheduled visits. And if she is diagnosed with gestational diabetes, then follow the doctor's recommendation, which should include an eye exam as well. And we'll go into more as to why it's important to check your eyes once you're diagnosed with diabetes. So, how can diabetes affect the eye? So high blood sugar, as we also call it, sugar, can lead to blurry vision, cataracts, glaucoma, and diabetic retinopathy. Blurry vision in diabetic patients normally caused by a spike in your sugar levels, which causes the lens in your eye to swell. It normally takes about 6 weeks to 3 months for your vision to normalize. This is why, one, you are recommended to keep monitoring your sugar levels and A1C to track sugar spikes or controlled or uncontrolled high sugar levels. 2, once you've had a sugar spike that causes sudden blurred vision, glasses are not normally indicated until your sugar levels and vision has normalized. Indicating glasses at this time can result in your prescription changing in a month or so and the glass becomes useless. So in my practice, I've come across a couple of persons who come in and say, well, doc, yesterday I could see fine. And then when I woke up this morning, things were blurry and I don't understand. So in the history, it's very important to know if the person knows that they're diabetic. So that'll be one of my first questions. Are you diabetic? If the answer is yes, then my next question would be, have you been tracking it? How has it been? Has it been high in the last week or two? And a lot of the times the answer is yes. So sometimes they say, well, it was 300, I had some mangoes, or it was 400, I had some cake. And so this gives me the idea that, oh, it might be the sugar. So what I will do is I will check their vision. I would still do the prescription, well, the refraction. And for me, this is useful because I won't indicate it at the time, but 6 weeks from now, I'll say, okay, come back in 6 weeks. Let's see how your sugar levels are. Make sure you monitor it over the next 6 weeks and have it stable. Once it's stable, you come back, we do it again. And a lot of the times, the difference between your first visit and that 6 week visit is completely different, which just proves the point that indicating glasses when your sugar level is high is not recommended because it just basically be a waste. So if you're a person who's not checking to see if you're diabetic, that can disrupt your refraction as well, because we don't know that you're not diabetic, that you are diabetic, and your prescription you come back a month later, but that I can't see in the glasses anymore. So that's why I stress on knowing your history of diabetes and checking. We can also check, well, I also check your random glucose in office, and that can give you an idea as well if you are currently experiencing high blood sugar or if it's normal. That's very helpful to have in clinic. Okay, so this is an example of somebody with blurred vision. Sorry, you wake up in the morning and it's just not what they used to be. And sometimes, a lot of times, even if they wear glasses, they will say, well, I can't see my glasses anymore. Okay, so another thing that can happen if you're diabetic is cataracts. And as Dr. Louise said, cataracts is when the lens in the eye gets cloudy. It is a normal aging process, and it happens with persons 50 plus and older. However, persons with diabetes, they tend to get cataracts faster and earlier. And I would normally describe cataracts to my patients as having a brand new glass. You buy it and it's nice and clear and crystal. And then after years of using it, it's not as clear as it used to be. It becomes cloudy and hazy. And that's kind of how cataracts are in the eyes. So here's an example of somebody with normal vision versus cataract. So yes, you can still see, but it's just not as clear and as sharp as it used to be. And as the cataracts get worse, it tends to get more and more cloudy. So what can be done for persons with cataracts? Well, in its moderate to advanced stages of cataract, ophthalmologists would normally perform cataract surgery, which entails the removal of your lens and inserting a new artificial lens. This is normally a short procedure of up to 30 minutes, after which you will be closely monitored to track progress. The objective of this surgery is to improve your vision from what you're seeing now. And that's in the moderate to advanced. So moderate to advanced basically means that even with your best corrected vision, it doesn't improve much. And so at this point, glasses will not help you anymore. In the early stages of cataract, it's just something that we monitor to see, okay, you do your regular checks, and this year, okay, you're 20/20 with glasses, the following year, you're 20/25, and so that's showing that your vision is dropping, okay? So that's cataract. Glaucoma, which Dr. Chiara spoke about just now, as we would have heard, it is caused by pressure buildup inside your eye with the fluid is unable to drain well. Now, persons with diabetes may get a condition known as neovascular glaucoma. As Dr. Chiara said, there are different types of glaucomas, and so this one is specific to diabetic patients. So in neovascular glaucoma, the new blood vessels grow on the iris. This is the colored part of the eye. This blocks the normal flow of fluid and raises the eye pressure. So it's important to note, as Chiara has stressed, as Dr. Chiara has stressed, and Dr. Lewis has stressed, whatever damage glaucoma does cannot be reversed. So early detection is the key to preventing blindness due to glaucoma. We're speaking specifically about glaucoma, right? And let's do an image of how glaucoma progresses. So normal vision, everything looks awesome. Early glaucoma, you're seeing some haziness, but it's not that noticeable. Advanced glaucoma, you're starting to see, well, the periphery looks a little darker, but the center, I can still see. In the end stage of glaucoma, it's pretty dark outside, and you have what we call tunnel vision. Again, we stress on the importance of early detection of glaucoma because as early pedestrians on the road when I'm driving, then you know the glaucoma is too far gone. And you know the objective at this point is to preserve what vision you have. So as Dr. Chiara said, glaucoma is normally treated with eye drops or laser. With neovascular glaucoma, they tend to focus more on laser surgery. And doing your recommended follow-ups would help to monitor progress and improvement to make sure the treatment is working. Sometimes you may need to do more than one, that's okay. The objective is for improvement. And everybody knows how important our sight is. We want to see our children and grandchildren and hopefully great-grandchildren. So this is very, 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 very important and common, very prevalent in Antigua as well, diabetic retinopathy. So diabetic retinopathy occurs when the small blood vessels in the retina are damaged. Uncontrolled and prolonged diabetes can result in damage to the blood vessels in the retina. In advanced stages of diabetic retinopathy, it can lead to blindness. It is especially important to have regular eye exams because untreated diabetic retinopathy is the #1 cause of blindness with diabetic persons. So again, you'll see in almost every single category, it's always important to get your eyes checked because early detection is key. Not knowing how diabetes is affecting your eyes will, eventually lead to complications that you really don't want. So here's an example of somebody with normal vision versus diabetic retinopathy. So in the diabetic retinopathy photo, the person is seeing black or dark spots in the vision. This is normally as a result of bleeding at the back of the eye or blood vessels, or even the swelling of the macula. So we hear us mention the retina often. So this is a retina, the normal retina versus the diabetic retina. You'll see the little streaks of blood on the retina. That's an indication of diabetic retinopathy. Okay. And then, that's something that you can't see unless you go to the eye doctor. You will never be able to tell this happening until you check your eyes. So treatment of diabetic retinopathy. So again, firstly, it is important to treat and manage the underlying cause of diabetic retinopathy, which is diabetes, right? This would mean keeping your sugar levels under control with medication and eating lifestyle. I know, as I mentioned earlier, eating lifestyle can be difficult because we in the Caribbean, we have a lot of sweet. There is mango season, there is fruitcake season, and there's always something sweet to eat. And so I would recommend to patients who's having difficulty controlling or readjusting their eating lifestyle to see a dietitian that normally would give them suggestions of what to eat to help help control the blood sugar. Okay, and also once you're diagnosed with diabetes, you are recommended to have an eye exam at least once a year. Just if you're diagnosed with diabetes, if there are complications following that, then you may be recommended to do monthly, every 6 months, depending on the level of your complication or your diabetic retinopathy. So here's a treatment for diabetic retinopathy. They're either treated with laser or anti-veg injection. So anti-veg injection is very quick and painless, and overall outcome is normally very good. The latest use of anti-veg injections has proven to improve your vision. It is done as a series of injections, 4 to 6, with monitoring after the injections. According to research, the injections, they sound alarming, but research says that it's not harmful, it's not painful, it's pretty quick as well, seconds. Just having to do the monitoring of it is what would help to make sure it's working. And it can help to improve your vision. Before the anti-veg injections came on stream, the objective with laser would be to try and keep your current vision. And now with the anti-VEGF, you can actually improve your vision. So that's, technology keeps improving, and that's something to celebrate. So even though injection sounds alarming, it will be for the better good. And so with severe retinopathy, which includes retinal tears and traction of the retina basically means there's like a pulling on the retina that can cause your vision to go, it can cause blindness. So they normally recommend a vitrectomy. In Antigua and some of the Caribbean islands, we do not do vitrectomies, and persons would have to travel to Trinidad or Barbados to perform this procedure. So imagine in our region where, yes, we're developing, but we're still not there yet where we can do these type of surgeries. And this is to help improve a person's vision or prevent them from going blind. So during a vitrectomy, the ophthalmologist removes the vitreous, which is a gel-like substance in the eye that gives it the form of the round globe form. and it replaces with a gas bubble or saline solution. During the process, if there are any tears, holes, or cataracts, this will be repaired or removed. The objective of the surgery is to improve vision or to keep it from getting worse. So for the 100th time in my presentation, you are recommended to have your eyes examined annually if you are diabetic. So thank you guys for listening. I hope this was very informative. You can follow my page at Paradise Vision Center, Facebook and Instagram. And remember, tell a friend, tell anybody that you know that's diabetic. Please get your eyes checked. Thank you.
Thank you, Dr. Jamila. That was very informative presentation on diabetes and how it affects our sight. Takeaway, ladies and gentlemen, for diabetic retinopathy is that early detection is key. Keep blood sugar level under control and test your eyes annually. Cannot overemphasize that one. Thank you very much, Dr. Jamila. Lion Sharon, over to you.
Thank you, Lion Norman. Lions, we must say that this discussion is going very good. At this point in time, I would like to bring to you our special guest speaker. Mr. Granville Cartby is a 59 Barbadian who lost his vision due to retinitis pigmentosa. Mr. Carter worked for 30 years at the Center of the Blind in Barbados, where he did many things, such as cane chairs, teach other visually impaired people to use technological visual aids. He also played blind cricket, where represented Barbados and traveled all over the region and even to India. Mr. Carter also had a job as a DJ on an online radio show. He is an active member and chair of various disabled and blind societies. Despite near total vision loss, within the past 6 years, he remains independent and currently runs a small business. I now present to you our special guest speaker, who experiences of a visually impaired person with experiences, of being visually impaired. Mr. Granville Cartby.
Yes, I want to say a pleasant good evening to everyone. The correct name is Granville Carter. I want to say to you this evening that my mind, I was born with an eye condition called retinitis pigmentosa, and it is commonly known as night blindness. However, I understand that there's another type of night blindness that when the amount of vitamin A is prescribed and taken, that it can correct the problem. However, that was not the case with me because I was born with my eye condition and it is also hereditary. Unfortunately, I have one other person in my family who has the problem. That's my oldest sister. However, my mind reverts to about 55 years ago when I saw myself as different to other children. Why? It's because that as soon as outside became dark, I would start butting into objects. And this made me feel very uneasy because my other siblings, beside my sister, were they had their perfect sight, and they could go anywhere in the night without experiencing any kind of problems. That was not the case with me. I refused. From the time outside started getting dark, I would not leave home. I remember going through primary school, and in those days, both my parents, probably my siblings, some recognized something about me. Not even the teachers at that point in time did not recognize that there was something wrong with me. At the age of 11, when I was supposed to sit 11 plus exam, I was experiencing problems with my vision. Again, I became, having very, very low self-esteem and becoming very shy and withdrawn, and would not reveal what was going on with me. This I didn't do to my parents or to my friends or to my teachers until I reached the age of about 13 years old. And then I went to the principal at the school and told him that I was encountering problems seeing the chalkboard. He then gave me a letter to take to bring home to my parents, which I took to our facility here, our institution called Emor at the time, where all the school children will go to get their eyes checked. In so doing, I saw one doctor at first, and he became very agitated at that point in time because he started administering Bicaplex for my condition. At that time, my condition was not diagnosed. And he was like, every time you come to me, I give you Bicaplex and your vision is not improving. I don't know what is wrong with you. So he decided to shift me over to a specialist. And I want to say to you that that was the most shocking time in my life, in the presence of my mother, who at that time broke down and cried when the ophthalmologist told her what was happening. The first time he looked into my eyes, he said, "Mr. Carter, do you have problems seeing at night?" And my answer was, yes. And right there and then he said to me, "You have a condition that is hereditary. You was born with it, and it is called retinitis pigmentosa." Well, you know what it would be like for a young person having diagnosed with such a condition, having to go to school, being around my peers who were probably not understanding at that point in time. And when mistakes are made, they would try to ridicule you. And that threw me into more depression all the time. I was given glasses to wear. At one point in time, I broke them up and threw them over the paling because they were no help to me. I think they used to hurt my eyes because of the strength. My eye condition was very, very acute. And when I go to the specialist and doctors begin to look into my eyes, they would call 4, 5, 6, 7 other doctors and say, come and see this gentleman. He has classic RP. And they will all be looking into my eyes. Okay, nevertheless, all because of that, I have encountered, because of this condition, so many problems. I refuse to go places with my friends. Sometimes I will go to a fair with my friends. And as soon as outside began to get dark, I would duck out and I would make my way home because I had to get home before outside got very dark. Because nobody is supposed to know that I have an eye condition. And it went on like that. And when I was in my 20s, it hampered me in school because when I had to read, I would appear as though I could not read. But it was not that I couldn't read, but it was because that my eye condition did not permit me to be able to see the letters. I remember when I was much younger and I joined the library. I joined the library. I would go to the section and I would take those books that had the very large print. So one day the librarian looked at me, she said, "What are you doing with these books? These are not for you. You are too old for these books. You have to go into the nether section." Well, you know, by that time, I had no more intention of going back to the library because it made no sense because I could not see to read the finer print. And in those days, technology was not like how it is now. But nevertheless, when I finished school, I wanted to do some evening classes. Oh, that's where the challenge came. And then I got the permission to do the classes, but then I said to myself, well, if I go and do those classes, how am I going to get home at night? Because really, in truth and in fact, I was not coping with my situation. I was not coping very good. I remember when my oldest sister was diagnosed and her problem became very acute. That threw me into a depression for about 2 weeks. And I could not talk about it when anybody asked me anything about her. I would just break down and cry for days. So one day she began to go to the Center for the Blind to learn to read Braille. So at that point in time, I was not working. So I said to myself, well, I still have a fair amount of sight, so I would take her. So I took her to the classes at the Center for the Blind. And it was then when I said to myself, Granville, but you know you have the same problem as your sister. And you know one day you're going to be like her. Why you don't start to do the Braille? So it is then I start to take Braille classes at the Center for the Blind. And I learned to read Braille with my fingers. Then I saw a lot of other blind persons there who were totally blind, some visually impaired, who had less sight than me. And they were telling me, look, the next time you come back here, don't let me hear you saying anything about you shame or whatever. So it is then at that point in time in my life when I started to make a change. And that is when my whole life started to change. And being among the blind persons and visually impaired person is what became as therapy for me. Then I was among the persons like myself, and my life grew stronger. I remember there were times when I would be walking to come into the center, and I would be looking back to see who would be looking to see if I would go there, because I was so ashamed and embarrassed. I didn't want to be around persons that were blind, although I was being faced with that situation. But in the end, all of that worn off, and I was then comfortable. I started to work learn how to cane and rush shears. And then I was sent to our handicraft center to do a course in basketry and bamboo weaving. And so things began changing for me. My self-esteem was still low because I refused to even talk with girls, because this thing was in me that, man, girls don't want nobody who is blind. So I kept myself to myself. I hardly sometimes used to go places until one day I said to myself, boy, you got to stop this foolishness. Life has to go on. So I said, next girl that I meet and we become friends, I will put my case to her and say, well, blah, blah, blah. And I met a young lady. She accepted me for who I was. She was fully sighted. And then sometime afterwards, we got married. And I have two sons, one 30 and one 25. And as a result of that, I then started to do some more training. Because when I left school, I had no kind of certification. So then I went and I did English at CXC level. I passed that at the grade 2. I did social studies. I got that at the grade 1. I did then at the Center for the Blind. I did Principle of Blindness and Office Administration. I was successful in gaining passes in grade 1 and 2. I also got social study at the grade 1. I also went to Earlston Teachers Training College and I did basic and advanced counseling. I also did a proficiency in Microsoft Office 2010, and then I did the fundamentals of spreadsheet analysis at one of our institutions here called BIMAC. So I improve on my life, I improve on my skills. I can tell you that right now, I am living a very rewarding life. I got myself involved in organizations. I was able to do many things, as was said in my bio. I played blind cricket when it was introduced to the Caribbean. And I traveled as a result of that to many of the Caribbean islands. I went all the way to India and things to that effect. So I am not treated by people do not scorn me. And I think it is because of the kind of personality that I have that people gravitate to me and people tell me, oh boy, you are something else. I'm a very ambitious person, and the amount of things that I do, people tells me that you do more than many sighted persons. And I know that I can play the guitar, I cook, I bake. If you eat some of my pone and some of my black cake, among sweetbreads, among other things that I can do. And so I see myself as a person who is very ambitious and who can live a rewarding life. And my life is very rewarding. I also sing, and I won the National United Society of the Blind annual Calypso competition 6 years straight. So I'm still the reigning king at the moment. The COVID has stopped us from having shows, but nevertheless, I will return. I also sing in one of our big tents here in Barbados, House of Soca. So I don't see myself different to anyone. I was able to teach persons like myself in IT, the JAWS users interface, how blind persons are able to navigate on the computers. I do a lot of things, and I feel very proud of myself. In the last 2 years, I was given a small shop to run. And the person who gave it to me said to me, the minister, he said, I'm giving you this shop for your hard work, and I want you to utilize this shop to continue the work that you was doing at the center, because I no longer go to the center. And I said, I don't really want to continue doing that. It will become a part of my business, but I'm going to do it on the side. What are you going to do? I said, I'm going to run a shop. And so I have a shop where I sell groceries, snacks, drinks, you name it. If you come there, you will see something that you would buy in my shop. And the amazing thing about running the shop, people say to me, but you are blind, how are you going to run the shop? But thank God that because of technology, it has allowed me to be able to run my shop very effectively. I use a program called Be My Eyes, so I can check my money, and I know where everything in my shop is located. So I do a fantastic job. So I don't feel lesser than a person. What I like about even my minister, when I first met him, he did not scorn me. He embraced me, and he treated me like a person. And that is what I liked. And I go everywhere with him, anywhere with him. And he is not ashamed of me. I am not ashamed of myself anymore. My self-esteem has risen to more than 100%. And now I am the type of person that, because of what I have gone through and what I have achieved, I can now win any person who is becoming blind or is blind back on the road to recovery. I know that there were persons who became blind and they were in their homes and would not come out. And I went for them. And today they are now back into society. I do all my business on my own. I do not even ask my children to do anything for me. I take up my cane. I mean, there were times that I was embarrassed to use my cane, and I suffered as a result of that. But I use my cane now. I travel on my own. I go anywhere on my own. I pay my bills. I go to the supermarket. I shop. Look, I can write a book about my life. And I know my life is a very rewarding life. And I want to say in closing, I thank you all for affording me the opportunity to be able to speak to you this evening and to give you my life story. I thank you very much for the opportunity again.
Thank you too, Mr. Carter. Wow.
You're most welcome.
Thank you very much for sharing with us your journey and experiences being visually impaired. You certainly did not let this come in your way. Wow. You enjoyed what you do and you lived your life to the fullest.
Yes,
and you did it so nicely. You are a great inspirator. Thank you again for sharing. At this time, fellow audience, we will take a few questions through the panel, and the panelists will be glad to answer all your questions. So we'll have questions at this point in time. If you have any questions, please put your hands, show your hands up so that we will be able to have, we'll be able to take you as we see the hands going up. And so the presenters will be able to answer your questions. Any questions, Lions, guests, Leos? Remember, you're muted, so you need to unmute your mic if you have a question.
Can I ask a question to Mr. Carter, please?
Certainly.
Mr. Carter, you talked about your two sons. Do either of those have your condition?
No. As a matter of fact, as soon as my sons were born and they reached the age of like 2 years old, I started taking them to the doctor because I know that my condition is hereditary, and it is highly possible that my sons could also have the problem. But as I said, one is 30 years old and the next one is 25. And up to this stage, none of them have developed any symptoms of the condition.
Fantastic, thank you. And can I just say thank you so much for talking to us all tonight. It was a wonderful story, really lovely to hear from you. So thank you so much. Thank you.
Appreciate that.
I thought Mr. Carter was.
Do you have any more questions for Mr. Carter of any of our presenters?
Shut up. I thought Mr. Carter was going to give us a calypso one. What a calypso was going on.
I thought so too. Can we have that?
Great inspiration.
Okay, I'll try to do one doing a cappella. Let me see which one I will choose. Oh my Lord, my head is going blank. This one is called The Solution. Oh boy. It seems as though that I have forgotten all my lyrics.
That's okay. That's understood. We should not surprise you with that. But I thought you've done a fantastic job inspiring us. So we can give you an excuse. We can excuse you on this. You're going to pass on that.
Thank you.
Any questions? Our presenters are waiting. They are willing to answer any question you may have on all of what was presented to us tonight.
Blind Sharon, I had my hands up. I don't know if you can or cannot see it.
Well, I'm not seeing, so you can go ahead. Sorry.
Okay. Blind Melanie, I had to change devices, so I'm not sure whether the question was asked whilst I was changing over.
No.
Mr. Carter, I would have liked to be reminded of the program which he's using in the show.
Oh, it is called Be My Eyes.
That's
Just Be My Eyes.
Barbados, or it's an international?
No, it is an international program. What it actually does is that you just go and you download BEMYEYES.com, and it would ask you if you want to be a user or if you want to be a helper. What it does, it is a program that what it does is that it gives you the access to real life persons. So the persons would come on when you click on the link, and they would assist you in doing anything. I've gotten them to like identify my clothes, things in the shop, things in the home, if I was washing my clothes, how to set my washing machine, things to that effect. If I'm cooking and there are canned stuff that may look alike, I would get them identified. So it is very, 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 very helpful. And it has helped me dramatically in my shop because, you know, there are a number of persons who came to my shop and thought that they could fool me, that they could trick me with money and tell me, oh, this is a $10 bill, or this is a $20 bill. And when I get a check, it is not what they said it was. So as a result of that, no one comes to try to trick me anymore because I have my apparatus there to assist me. So someone was saying they wanted me to sing a song. I can probably just do a quick one, the verse and the chorus, if you would permit me to. All right, so I'll do a normal song. There goes my only possession. There goes my everything. I hear footsteps slowly walking as they gently walk across the lonely floor, and a voice softly sing, darling, this could be goodbye forevermore. There goes my reason for living. There goes the one of my dreams. There goes my only possession. There goes my everything. As my memory turns back to you, I can see the happiness we had before, and the voice softly saying, it was raining when it's charging up the door. There goes my reason for living. There goes the one of my dreams. There goes my only possession. There goes my everything. There goes my only possession. There goes my everything. Thank you.
Amen. Round of applause. Very good.
Thank you.
Mr. Carter, just let me read to you some information that was sent to you on the chat. Someone said this life story is fantastic. Inspiration to everyone, especially at a time when most of us have experienced tremendous stress in our lives during this pandemic period. Thanks sincerely, Mr. Carter, for sharing. Someone else said, what a motivator. Life is all about acceptance and being comfortable in your own skin. Beautiful.
I
So
heard, not
they
crossing
love
you,
it, Mr. Carter. Thanks,
I'm
sir.
not crossing you. I heard a lot of people talk about the pandemic and how it has, you know, created a lot of stress for people. But for me, I lived pretty comfortable during the pandemic. Some people said it has caused psychological problems on them. I because of my life being so fulfilling and rewarding, I don't have a problem even being at home. I feel comfortable. I'm at home. I go on my phone, my iPhone. I do so many things. I can use the computer better than some sighted persons. I can type, I can do so many things. So my life is a rewarding life. I don't have no time for wastage. So I adapt to suit the situation. So I just want to encourage you all to, sometimes I ask myself in terms of my blindness, and I could just fall up and do nothing and feel sorry for myself. But I am a person who loves life and I love to live on. So I go so many places, do so many things, mix with people in government. I cannot, I don't have much tongue to say the amount of things that I do. And I am proud of myself. And I want to encourage persons that are blind and visually impaired to change your mindset and tell yourself that we have a slogan here in Barbados that we say, there is life after blindness. Don't tell yourself because that you become blind that is the end of the world. That is now the beginning. We have to show the world what we can do. And once we show the world what we can do, our lives will be very, very inspiring and rewarding and inspirational to others. Thank you very, very much.
Thank you, Mr. Carter. I think we have a question from Judith.
Go right ahead.
I want to ask Mr. Carter if his sister is as active as he is.
No. Ladies, right? Ladies will be scared to even walk the road by themselves because they have a fear that some guy might come and trouble them. But I am not worried about that. I go everywhere by myself, day and night. So I see myself different. I see myself as different and more ambitious. Yes. Thank you very much.
Lion Leslie Ann, did you have a question? I saw you were popping up a while ago.
No, Lion Sharon, no, I don't.
Okay, thank you. Any more questions? Leo's, Lions, guests? No? At this point in time, let me thank each one of you for all your questions. And at this point in time, it's kind of getting late. I will now call upon Lion Norman, who will do our vote of thanks for it. Lion Norman.
Thank you, Lion Sharon. This presentation discussion about blindness, cause and prevention is very fitting and important at this time, which is Blind Awareness Month. Lion Sharon Ephraim, Coordinator, Vision Commission, Lion Maureen Graham, PMJF, District Governor, other distinguished Lions, Leo's guests, my fellow Lions in the virtual audience, a pleasant good evening. It is my privilege to have been asked to propose a vote of thanks for this very interesting occasion. On behalf of the Vision Commission of 60B, I would like to express our sincere thanks and appreciation to our esteemed presenters and everyone who makes this presentation the success it has been. I begin with our presenters. We have Dr. Louise Purcell, who spoke on the definition of sight and what blindness means. Talk about how to protect she gave us some tips on how to protect our eyes during gardening and doing sports spoke on diseases. World leading cause of blindness is cataract, but we in the Caribbean, what affects us most is is glaucoma. All right. Move to Dr. Sierra Divine, spoke on glaucoma, gave us some tips there, and we are more knowledgeable from her presentation on glaucoma. Even though it is irreversible, there are things that we can do to slow its progression. Gave us some tips. And one thing, the takeaway was that we should test our eyes at least once per year. Right? Move to our third presenter, Dr. Jamila Fabian, spoke on diabetic retinopathy and also on diabetes. Talk about early detection, keep sugar level low, keep it under control, test your eyes annually. That's the takeaway. Then we move to our guest presenter, Mr. Granville Carter. What can I say? Very inspiring. Moving from low self-esteem, withdrawn at age 13 with visual challenges, to, confident man, a gentleman with so much confidence and ambition and high self-esteem. Talk about how he met his wife and talk about how he overcome all of this. And now he's got so many prizes in singing, etc. And his versatility in gardening and everything. He's living a wonderful life, a rewarding life. Thank you, Mr. Carter. Very inspiring.
Thank you very much.
All right. I would like to also thank our district governor. Special thanks is accorded. Through a special permission allow us to have these very important and topical discussion, blindness and cause and prevention. District Governor, thank you. I want to thank our Cabinet Secretary and the Secretariat for helping us with disseminating the related information to the clubs and also to the district. I wanted to also thank our Information Technology and Communication division. Lion Wendy, thank you for assisting us with the Zoom platform so that we could have this discussion and presentation. Really appreciate it there. You were with us early and organize everything so we could have a smooth presentation and discussion. Lion Beatrice of the Castries Lion Club for assisting us with disseminating information on social media. Leon and our assistants, their contribution, we thank you very much. And you, the audience, what can I say? Very disciplined audience who participated somewhat actively. We could get some more questions though. The questions were on point, some of them. I'm sure that each and every one of you are more aware of the cause and prevention of blindness. Let us continue to be Night of the Blind and the crusade against darkness as we build a better tomorrow through kindness. Once again, thank you for attending. Do have a pleasant evening. Thank you all.
Thank you too.
Thank you. Good night.
Good night.
Thank you. Good night.
Thank you, everyone. Thank you for coming. Thank you to our presenters. Thank you, Mr. Carter. And thanks again to all our audience. It was nice having you all. Let us all continue to build a better tomorrow through kindness, through taking care of the blind, through taking care of our health, and of course, our sight. Thank you so much, everyone. Have a pleasant evening.
Thank you.
You too.
So
if you want to put the good work,
I'd like Sharon.